Hello, I am Dr. Uday Bhaumik. I am a consultant neurosurgeon at Gitanjali Medical College Hospital, Udaipur. And my heartiest greetings to all the viewers, and would like to extend my helping hands to the benefits of the neurosurgery patients. Neurosurgery is a subspecialty of the surgery which is related with the brain and spine surgeries. And the brain surgeries can be broadly divided into main two groups. One involving the emergency types of surgeries and another is the routine type of surgeries. In the emergency surgeries, mostly we see the head injury types of patients and the spinal injury patients. These head injury patients constitutes a major referrals to any neurosurgical center, being high prevalence in the society and involving majority in the younger age group patients. So it involves lots of social concerns, social trauma, stigma onto the patients, and so they reach to in a large number of the patient, to the neurosurgical centers. So these, similarly in the spine surgeries also, patients sustaining high-speed trauma also sustain some of these spinal injury patients, and they reach to the neurosurgical centers. Neurosurgery also involves the routine surgeries, which can be broadly divided into neurovascular surgeries. Vascular surgeries means any structural deformities into the vascular structure, like having an aneurysm in the brain or having a vascular malformations in the brain. These vascular malformations and the aneurysms are amenable to surgical clippings and coilings, and so they reach to the neurosurgical centers. Another group is the skull-based surgeries, the tumors involving the base of the skull. These tumors involving the base of the skull have got are potential dangerous to the patient's health outcome because of their deep locations inside the brain, and so centers should be also well equipped with all the gadgets, with all the modern facilities, so as to tackle these deep-seated lesions involving the skull base. Another type is the neuro-oncological services, which involves mainly the tumors involving the brain parenchyma or the spine. These surgeries can also be done in few centers with the help of the neuroendoscope, and these constitute neuroendoscopic surgeries. Another group of the patients involved which are reaching to the neurosurgical centers are of the spine surgeries. In spine surgeries, we mainly see the degenerative diseases of the spine, of the cervical spine, of the lumbosacral spines, patients having this diseases like complaints of the sciatica, complaints of the low back pains, complaints of the cervical are all patients who are candidates of the neurosurgical services. They should be adequately screened, they should be adequately treated so as to give them a fruitful life into their future. In neurosurgery, we have got the chances of error or the limitations of error are very bleak, very small. We cannot leave the patients even with the smallest of the errors because of the high chances of landing into neurological deficits and neurological problems. In some of these surgeries I have operated in last few years, I would like to focus my attention onto those surgeries. In one surgery, that is a hereditary disease of the brain. This disease is mainly involving the brain parenchyma, and it is majority a disease of the poor people, countrymen who are basically involved with the farming and sheep rearing or animal rearing type of the occupations. This is sort of occupational hazards also. The patients who are involved are mainly from the rural background. They are involved with these types of activities, and they become victim of the Helminth disorder, which is called as a tinea solium. So when its embryos are hatched, they accidentally enter inside the systemic circulation and land up into the safe places. And one among the rarest place to land up is into the brain. I operated one patient of the hereditary disease of brain at medical college, and where we had to take out the whole of the disease out of his brain, and now the child is recovering well, and he has been now living in a disease-free state for last 1.5 years.